who is a non-surgical cosmetic physician. Very important to stress the non-surgical type. This is not a plastic surgeon who's coming in here and wants to rearrange your face, but what you do want to do is help create a better us.
Absolutely.
And one of the things, along with acne and other skin ailments that hits so much of the population, is rosacea. Full disclosure, I have it. Here's a picture of me this morning at 4:45. This is my cheek. See the redness? Doctor, what causes that?
So actually, we don't know what causes rosacea.
Okay.
We know that it's a chronic inflammatory skin condition, which begins as redness on the central part of the face. So typically the nose, the cheeks, the forehead, the chin. It begins intermittently, so the redness comes and goes. But if you don't treat it and you don't manage the triggers, it gets worse. And eventually red veins appear on the cheeks
right
and
there.
the nose.
You can see that on my cheek.
Exactly. And then eventually you can get bumps and pimples also on the cheeks and the nose. And then it can get quite severe if it's left untreated. And rosacea is what's referred to as a progressive skin disorder. So if it's not managed, it will worsen with time. And that's why it's so important to understand what the triggers are.
Tell us what the triggers are.
So different people have different triggers.
Okay.
The main ones are dietary, so spicy foods, chocolates.
Which I love.
I'm sure you do. Chocolates,
foods, yeah.
Alcohol, particularly red wine.
Right.
Red wine is a common trigger for rosacea. Extremes of temperature, so cold, heat, sun exposure, wind, high intensity exercise will cause rosacea to flare up, as will stress, believe it or not.
Wow, you just covered off my life in a nutshell. No, but when I lived in Toronto, my rosacea got exponentially worse because of the wind and the absolute crazy cold temperatures. I really noticed that difference, and then the really hot summers. Okay, so what are our options if we take care of the dietary side? How can you help us? What do you do in your clinic?
So the first stage of rosacea is what's called just flushing and blushing. So that's where you have this intermittent redness that's coming and going. And at that point, we want to change your lifestyle, manage the triggers, but we do now have laser therapy that works very well to treat rosacea. And again, rosacea cannot be cured, but we can treat it.
So we've got some before and after shots that you've brought for us. Let's talk about this, talk about how much it costs. We're getting low on time, but I want to get to these. So
that's a before photograph, and you see the red veins on the cheeks and the upper lip. So this patient was then treated with what's called IPL, or intense pulse light, which is a type of laser.
That's a significant improvement.
It's beautiful. It's beautiful.
And now how much did she have to pay for this?
So if you do, in my clinic, a half face treatment is $200 per treatment, but you might need 3 to 4 treatments spaced about 2 to 4 weeks apart. So it's not one single treatment. You come in and get a series of treatments, but you'll notice improvement with each subsequent treatment.
Right, and then you stay out of the sun.
Then you stay out of the sun.
Let's look at another before and after.
Avoid the triggers, and then you'll reap the benefits. So this is a before photograph. You can see the redness, the inflammation beforehand. And then this patient was treated with IPL, again laser, and you see that, because what the laser does is it basically coagulates or clots the blood vessels and eliminates the redness, tightens the vessels.
Do we have another
and the
one?
redness disappears.
I think we have one more. There we go.
Again, so you see the vessels, you see the nose and the cheeks, and a little bit on the chin as well. Those are the main areas. And 2 million Canadians have rosacea, so it's very common.
Is there any coverage under medical for this? I'm just throwing that. Don't want to put you on the spot, but
if it's a debilitating condition, so there are more severe forms of rosacea where it can affect the nose, can become bulbous and bumpy. That's called rhinophyma, or you can even get rosacea in the eyes. That's called ocular rosacea.
Those are covered.
In those cases, it can be covered. The initial cases, just with the redness and the flushing, that's primarily cosmetic. And if it's cosmetic, you're on your own.
Okay, so here is the website. If you want to find out more about what Dr. Alibhai does, we are going to post this on Facebook. If you have rosacea, if you have questions for the good doctor, please put them on our Facebook page and we'll forward them to you. I'm going to get this treatment done over the next 6 to 8 months, and you have to keep it up. So I will keep you informed, because like Michelle McDermott and Tamara Slobodjan, all of us have rosacea, and we're going to try and get rid of it and treat it, and because you really can't get rid of it, but we'll try and
manage it.
Take a dent into this, and maybe we can help you as well. We'll be back in a moment. It's 8:55. You're watching Breakfast Television on City.